Okay, so health updates for Ghana. I'm going to read it. Okay. Western Regional Coordinating Council for immediate release. Headline says, the Western Regional Coordinating Council takes action to curb cholera outbreak. Ban on vegetable sales by food vendors. This is dated 10th of December 2024. Now, the WRCC, which is Western Regional Coordinating Council, has announced urgent measures to address the escalating cholera outbreak, which has reached critical levels in the region. As of December 7th, 789 suspected cases and 8 deaths have been recorded across various health facilities. So daily reported cases exceed 60. So more than 60 people are being diagnosed of cholera a day. That's alarming.
Yeah.
You know, and that's within the Sekondi Takoradi Metropolitan and Efia, Kwesi or
Yeah.
is it Efia or Efia? Efia, Kwesi municipal areas. Yeah, environmental surveillance investigations reveal that 96% of infections are linked to food vendors. Okay, particularly through the sale of contaminated vegetables such as salad, leaves, and green peppers. These findings have prompted immediate action to protect the public health. So they announced an immediate ban on the sale of vegetables by food vendors in the region, and offenders will face prosecution according to Public Health Act and all that. So the general public is strongly advised to avoid purchasing or consuming vegetables from food vendors for their safety. Meanwhile, vegetables purchased for domestic use should be treated properly before use. Okay, so issued by the regional environmental health analyst. This is not good news. 2024. Why are we having cholera outbreaks in Ghana?
Just when we are ending 2024.
What it takes to have cholera is strictly bad hygiene, poor hygiene.
Yeah.
Poor hygiene. It takes feces to get in contact with what you're going to consume, food or water, and that means hygiene is not really it's not not the best.
Fecal oral transmission.
Yeah, it's not
you
the
just
best.
touch unclean stuff, you take them to your mouth, and then over time symptoms begin.
No, I was a bit disappointed to hear that we are still having cholera outbreaks in Ghana.
Our hygiene level, personal hygiene levels are still low.
I'm bad, yeah. And food vendors, realizing that it's the hot spot. So food vendors, outside food, but outside food is convenient for some people, so they cannot do without it. Okay,
but growing up,
yeah,
there used to be active education on how to maintain personal hygiene, environmental hygiene. But nowadays, we don't see such.
We don't see that.
we don't see them often on the
during the COVID era, right? Cholera cases dropped drastically because now everyone was ensuring personal washing hands, use of sanitizers. So it was good. It looks like most people have
stopped.
Have stopped that.
It's true.
But it's not just for COVID. Personal hygiene is a daily thing you should do to reduce your chances of getting infections and all that. It's not good, but usually when there are outbreaks, right, you hardly hear them having to ban the sale of food vendors. Usually, when you're studying the topics and all that, it's when it comes to prevention, you talk about ensuring personal hygiene and all that, vaccination. But here's the case: they have to do banning, and I don't know. Well, let's see.
I'm sure it shows how severe the case.
Well, they said in the 90-something% of cases, and well, there's good news too. Maybe by the time we are talking about this video, they would have ended. But they launched a cholera vaccination campaign, dated 15th to 19th of December. So this is open, or it was open to the general public. Anyone aged 1 year and above is eligible to receive the cholera vaccine. And they stated the centers and the districts where you can go for them. So the vaccination teams are visiting people.
Yeah. So in case you don't know, there are cholera vaccines available.
Yeah, to protect yourself, your family, your community.
Yeah. And also to add that most people, I don't know, over time, education concerning these public health conditions over time it has reduced.
It has.
So
it has.
For example, in the case of cholera, people will have the symptoms. The initial times they will think, oh, it's a normal gastroenteritis.
Okay. Mm-hmm.
So let's say an episode of diarrhea
Yeah.
passes, followed by vomiting.
Yeah.
And then the person will be like, oh, okay, oh, it's normal. Maybe
Okay.
I will recover over time. A day passes by. After maybe several episodes, the person refuses to visit a health facility.
Yeah.
And then it goes on the second day. Hopefully the person survives the second day. And then the third day, that is when the person becomes weak.
Yeah.
So even the strength to get to a health facility will be a problem.
Yeah.
And that's how they come in severely ill.
Yeah.
And then soon after that, they die.
Yeah, there are people dying. And the main issue usually is dehydration. What it means is that the moment you are running, you need ORS. You need to start
fluids.
hydrating. Yeah, with electrolytes, and you need to replace them. So let's learn that.
So I think starting prompt management.
Okay.
The moment you see any symptom of diarrhea or vomiting, will help.
Yes.
Individual.
Yes. And find yourself in the hospital. So on your way, be hydrating, be taking in your ORS. Okay. Yeah.
And I think it will also be advisable that people get ORS
at home.
Yes.
Because
you don't know when you will come in contact with contaminated stuff, and then you start manifesting
running or vomiting. Yeah, and then zinc for children who have diarrhea.
Yes,
is very beneficial too. So right.